Hello, Sofia Zapata here, back with another video. This video is for a finger stick. So this will be my assignment for today. And my homework is to explain the difference between a hematocrit finger stick, hemoglobin, and a glucose finger stick. So let's begin with that. So the difference between all these, I'll tell you right away. The hematocrit is a measurement of the percentage of packed red blood cells in a volume of blood. So this compares the volume of red blood cells to the total volume of the whole blood sample. So this is to detect the volume of red blood cells. That is for a hematocrit. For hemoglobin, it tests the oxygen levels. So it is another way to measure the oxygen carrying the capacity of the blood. The factors that can affect a hemoglobin level is age, gender, a diet, altitude, and also disease. That can affect your hemoglobin levels. For next up is glucose. That is the level of sugar in your blood. A glucometer, perhaps that is for the finger stick that we will be doing today. The glucometer would be used to check both fasting blood sugars and non-fasting sugar levels. So now that I have explained the difference of these finger sticks with hematocrit, hemoglobin, and glucose, now we're going to go ahead and do the finger stick for glucose. So let's begin. Firstly, you want to check the provider's orders and also get the supplies that you will need for this finger stick. You are going to need the patient health record, your glucometer, the test strips, a lancet, alcohol preps, gauze squares, sharps container, disposable gloves, biohazards waste container, and then that is the only things you're going to need for this procedure. Make sure that you sanitize and you wear your disposable gloves. After that, you are going to greet yourself to the patient and you are also going to verify them by asking them their name and date of birth. After you have done that, you are going to go ahead and check the patient's middle and also ring finger. You are going to check which finger is better for the finger stick. You want to make sure that you prep the finger, warm it up. Sure it's nice and warm for the blood. And remember, you do not want to finger stick the patient here. You don't want to do that there. You want to do it on the side. And if the patient happens to have scar tissue or any scars here, you are going to do it on the other side or whichever finger is more smooth for the finger stick. You are going to select the side. After that, you're going to turn on your glucometer. By pressing on, you're going to check the strip. If it is expired, make sure that the strip is not expired or else you will get an incorrect glucometer reading from the patient. You are going to clean the area. Then you are going to let it dry. After that, you are going to perform the finger stick. You grab the lancet and you are going to press it, and that will immediately sting the patient and blood will start coming out. When that happens, you are going to wipe the first blood. You always want to make sure that you wipe away the first blood. Then you are going to go ahead and get the strip. You're going to put the blood inside the strip, and that strip will go into the blood. Into the blood sample, you will put it into the glucometer, and that is how you perform a finger stick for a glucometer. There is more information on that, but that is how you perform a glucometer reading. The rest is also very important, but I was told to let you know how I would perform a glucometer, a finger stick. Not a glucometer, finger stick, but just a finger stick. And after you do that, you are going to give a patient a gauze square to hold securely over the puncture site. The glucometer automatically begins the measurement process and results are obtained in as soon as 4 seconds. The test result is shown in the display. I have a picture here that shows the reading and the test strip on the bottom. So this is just information towards the end on what you will do after you obtain the finger stick and after you have stung the patient, what you do after that. I have it in the book. But yeah, that is how I would perform a finger stick. Thank you very much. Bye-bye.